what we want to talk about is something that I wasn't even gonna address this evening,
Oh boy.
but you brought it up.
I brought it up.
Yes,
Incredible.
You brought it up.
All right, I'll be the bad news bearer.
You brought it up, and I think it's a really important issue about what is Dr. Gupta?
I believe so. I believe that's his name.
And he was on Channel 5, is it 5 or 9?
I think it's
NBC, CBS, one
I
of the
think
major players,
yeah.
one of the big guys,
Yeah.
okay? And he was talking about epilepsy and weed.
Oh gosh. And we're going to YouTube, huh?
Yes. He's talking about epilepsy and weed, and he's talking about this woman who was having like 300 seizures a day.
I think it was 300 a month. It was something around there. I don't think it was
It was a
300.
boatload.
Yeah. It was 300
It was a
a day.
boatload of seizures, and suddenly she started firing up. She was firing up in one sense, and not firing up in another sense.
And she said she needed a mellow. She needed to mellow out. So yeah, so you've got some issues with this. What are your frustrations?
Well, this is one person, okay?
Okay.
He got on the air and he sort of sounded as if he was offering this particular therapy for everybody. You know, it's like, hey, if you got epilepsy, heck with that other stuff, let's smoke some weed, you know? And go,
Well, at least he didn't say do smoke cake spice. So I mean,
yeah, because that causes seizures. So you got to get the real thing. But this is one woman, okay, who's had one type of seizure, okay, and is suddenly establishes control because supposedly she's smoking marijuana.
I believe on the thing they called it cannabis, though.
Cannabis?
Yeah, I'm just saying if we wanted to stay technical with the terms.
Okay.
I think it all
But
comes
she's
boiled down.
smoking this stuff, and that might be good for her. Okay, but epilepsy affects everybody pretty much on an individual kind of basis. Okay, no two people with epilepsy have exactly the same type of seizures, and epilepsy doesn't affect everybody the same way. It affects everybody very, very individually. I take issue with the fact that this guy is saying this, and I would certainly hope that nobody got the impression that this is some kind of miracle cure for your seizures.
Well, I think that's what, and we were talking about that earlier, just making sure that the information is taken to remember that it just is on an individual perspective, that there probably needs to be more research done on it to see how differently it does, whether it hurts or if it does help with certain type of seizures. Because like you said, I mean, we've got partial epilepsy, general tonic-clonic. I mean, so there's so many different pieces. We don't know what that was, but I think to have more information on it will help, again, dispelling the myths, because like if he's saying that it could have just been directed towards that woman, or like you said, everybody comes out and they're like, yeah, bring a bag and come to party, and that may not be the best thing. So I think what we want to do too is just make sure that the right information is out there. So we talked about if there's any type of person, well, not any type, let me switch that, we would like to have medical professionals, and even someone having a focus on epilepsy, so an epileptologist or a neurologist, maybe provide us with more information
about this, because it's certainly, I don't think the research is out there, and that's what kind of bothers me, is that, if you go on do a Google search on epilepsy cure, you'll get all kinds of things that'll come up, okay? And most of them have no kind of medical foundation whatsoever. There's no kind of testing that's been done to prove the effectiveness of these things. Try this, try that, kill the chicken and bury its heart out in the back of the yard during the full moon, you know? You hear those things. And it's like, that might be good for the curse that somebody's placed on you, but it doesn't help for the epilepsy. And that's my point, is that there isn't that research there. So I'm real skeptical of this.
Well, and then I know that your passion lies in you want to dispel the myths, not increase them.
Yeah.
And the last thing we would want to happen, with us or just overall, is someone take this information, abuse it, and then it, even though it's having a lot of, it's in the news and it's a hot topic, that it end up being something that really brings on more of a dissatisfied people, hardships on their lives. So, it just, like you said, it's on a personal note, and that's something that you should still talk to your neurologist or epileptologist about.
One of the things that I look to try to achieve with people that I meet who have epilepsy is to increase their quality of life.
Mm-hmm.
Okay, I might not be able to help them control their seizures any better, but maybe I can help them as far as increasing the quality of the life that they do have. And I have questions as to whether or not this is actually works towards that particular goal. One of the things that I hear from people time and time again who have epilepsy is that they have memory problems.
Mm-hmm. What? What were you just saying? Oh, okay.
Let me refresh this for you. They have memory problems. Now, from what I understand, people who smoke a fair amount of weed have memory problems.
What's the amount?
I have no clue. But
Can't remember.
Are you having memory loss, Tom?
But my point, Margaret. My point is that.
Okay, back to the point.
Why would somebody who is already having problems with their memory smoke marijuana?
I don't know.
My God, that'd be like giving an Alzheimer's patient weed.
Oh, gosh. I don't know.
This is good for you.
But see, we could play devil's advocate. I don't plan on it, but I'm just saying. We could, but I think that what we should do too? We should take a poll. So, now that we're, going out social media and whatnot, we should, once we hit YouTube and whatnot, we should ask, let's do a poll. How many people think that weed will help, or cannabis, or whatever we want to call it, will help, or if it'll hinder. And then, maybe we'll work to empower our friends in the southwestern northern Kentucky area.
And maybe what we do is we ask those people to contact those individuals who do have a vested interest in this. Okay, people who can actually move forward some studies on this to find out for real what's going on.
Now that would be I wonder how many people would sign up for that focused epilepsy crew. $40 gift card, here we come. What? I bet you they remember that.
But that's the thing, is that, we need to get some kind of the research needs to be done. The claims are out there, okay, let's find out if they're true or not. That's what I say before, and let's, I just don't want to see people wholesale going off and.
So we want to hear the people's input. So how do they do that?
Well, what they can do is they can contact us at 1-877.
804.
804-2241.
2241.
See, I forgot.
Ah,
No.
what? Oh, snap.
Or they can contact us at www.epilepsy-ohio.org. You got those down pat, I just don't.
Yeah, I better, because I did that good old PSA announcement, and I was getting all heart throb, do it right, Margo. So, yes, I got my stuff
But
together.
that's something that I think is, I think it's a hot button issue.
Mhm.
You know, and it's like, okay, you know, talk to your legislatures, talk to some folks, you know, who can do something as far as setting up some kind of a study so we can find out if this is
And I think that
true or not.
we want to make sure that we are moving towards having productive information instead of putting things in the wayside to, you know, go just like home remedies. So, you know, you don't want to tell somebody to drink black tea and that'll help their epilepsy, and it's just great tea. So, you know.
But there are things online that you'll find that'll say that.
Right,
You know?
right,
So we don't want to be one of those things.
right. We want the real info.
We want the real deal. Exactly.